Questions, answers, medicine made simple.
Hi everyone, I'm Dr. Keka. And welcome to Ask Dr. Keka, where we make medicine simple.
Many people think skipping meals is what causes a stomach ulcer. But is that really true? Don't worry, in today's video we'll explain it simply. Let's talk about peptic ulcer. A peptic ulcer is simply a sore or wound in the lining of the stomach or the upper part of the intestine. Just like a wound on your skin, it hurts when irritated. Have you ever wondered why it's called peptic ulcer? The word peptic comes from pepsin, a digestive enzyme in the stomach that breaks down protein. Your stomach also produces acid every day to digest food, but it also has a protective lining that shields it from this acid. As long as that protection is strong, the acid does no harm. But once that protection is damaged, stomach acid can now touch the stomach wall directly. Over time, this constant acid and pepsin enzyme irritation leads to a sore, and that sore is what we call a peptic ulcer. The most common cause of peptic ulcer is a bacteria called Helicobacter pylori. It does this by producing substances that weaken the stomach's protective lining. This now allows the stomach acid to have access to the stomach wall, causing damage and forming a sore, also called ulcer. Overuse of pain medicines called NSAIDs can also cause ulcers. A popular example is ibuprofen. NSAIDs work by blocking certain chemicals in the body that cause pain and inflammation. But those same chemicals also help protect the stomach lining. Without protection, acid can cause damage. When NSAIDs reduce these protective chemicals, the stomach loses part of its protective lining, and this leads to ulcer. That is why frequent or prolonged NSAID use increases the risk of ulcers and bleeding. Apart from the bacteria and NSAIDs, there are other less common causes of ulcer. Severe illness or major stress on the body, such as burns or serious infections, can increase acid production. Smoking slows ulcer healing and increases the risk of complications. Excessive alcohol damages the stomach lining and worsens ulcers. The most common symptom of peptic ulcer is upper abdominal pain. The pain may be described as burning or even aching. Ulcer pain is often related to meals. Some people feel pain when they're hungry. Others feel pain shortly after eating. Ulcer pain may also wake someone up at night. Some people with ulcers feel nausea or bloating. They may feel full quickly when eating. Because eating can be uncomfortable, some people eat less. This may lead to weight loss. Some symptoms are warning signs and need urgent medical care. These include vomiting blood or passing black stools. These signs suggest bleeding. Not everyone with ulcer has symptoms, and many stomach problems can feel like ulcer. That's why symptoms alone are not enough to diagnose ulcer. Proper tests are needed to confirm it. Some common tests include breath tests, stool tests, and blood tests, especially to check for Helicobacter pylori. These tests help us know if the bacteria is present, but they do not always show the ulcer itself. The definitive test for diagnosing peptic ulcer is called endoscopy. Endoscopy allows the doctor to directly look inside the stomach using a small camera. This test can clearly show whether an ulcer is present, how big it is, and whether there are complications like bleeding. Treating yourself for an ulcer without confirmation can delay the correct diagnosis and proper treatment. Ulcer treatment should be guided by a doctor. Ulcer treatment mainly focuses on reducing acid, healing the lining, and removing the cause. Some medicines reduce the amount of acid produced by the stomach, giving the ulcer time to heal. Other medicines help protect the stomach lining. If Helicobacter pylori is present, antibiotics are used to eliminate the bacteria. If NSAIDs cause the ulcer, they should be stopped or avoided. Safer pain relief options may be recommended. Frequent use of pain medicines like NSAIDs should be avoided unless prescribed. Smoking and excessive alcohol intake can worsen ulcers and delay healing. Some foods may not cause ulcers, but they can irritate symptoms, so patients should pay attention to what worsens their pain. Ulcer is often misdiagnosed because many abdominal pains feel similar. Before saying you have ulcer, proper tests must be done to confirm it. All right, that was a lot of information. Let's see how much you remember. Okay, let's do a quick mini quiz. Are you ready? Which of these is the most common cause of peptic ulcer disease? The correct answer is C, Helicobacter pylori infection. True or false? Skipping meals causes peptic ulcer. The correct answer is false. Skipping meals does not cause ulcers. True or false? Any stomach pain means you have an ulcer. The correct answer is false. Many conditions can cause abdominal pain. Which medicine increases the risk of ulcers when used often? The correct answer is C, NSAIDs like ibuprofen. Which symptom is commonly associated with peptic ulcer disease? The correct answer is C, upper abdominal pain. How many did you get right? Drop your score in the comments. A peptic ulcer is a sore in your stomach. It's like a grumpy bubble that hurts. And that's all for today. If you enjoyed this, like, share, and subscribe so more people can learn. Bye!